And we are recording, and therefore my goal is really to say thank you to you, and once again tell you how incredibly honored I am to be your chair for 3 more years, but who's counting? Okay, here we go. I just need to full screen. Is that full screen for you guys? Mm-hmm. Yeah, works. Mm-hmm. Okay. As I think everybody knows, the most appropriate place to start these rounds, this celebration, is with our acknowledgement of the land on which we sit. You know, I've been reading this land acknowledgement for the last several years, but it feels very different right now. So I'm going to say it again. We'd like to acknowledge this land on which the University of Toronto operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island. We are grateful to have the opportunity to work here, to live here, to be here. And I wanted to share this piece of art by Christy Belcourt. And I hope that we continue to remember. So as I said, this is atypical. This year we did not send out a request for nominations awardees because I really didn't want the burden of nominations put on incredibly busy and stressed people. We have not forgotten about awards, and we will probably, depending on what happens with or without a fourth wave, let's all just hope no fourth wave. I'm looking at Jerome, so I know he hopes no fourth wave. But we will either post for nominations in September, or if worst case comes to worst, we'll double up and do 2 sets of awards next year. But I just want you to not worry, we haven't forgotten them. We decided we'd do something a little bit different this time too, because we are celebrating the 100 years since the discovery of insulin. And you may or may not have noticed, but the bookstore has some incredible stuff, swag. So we're actually doing a bit of a draw. And if you go to SurveyMonkey, which is probably now in the chat, and you'll also be sent it, there are puzzles, tote bags, journals, all sorts of stuff, and you can sign up and be part of a draw. You can also, if you don't win anything, you can go to the bookstore virtually or in person. There's some great memorabilia. So what I would like to accomplish for purposes of continuing education is to understand, I would like you to understand how our voices collectively and our actions have the power to affect meaningful change. And I think the last year is an exemplar of that. To feel pride, despite all of the trials and tribulations of the past year, in the amazing accomplishments of this department, and really to recommit to working together to accelerate our efforts to advance academic excellence within a culture of caring, kindness, respect, and inclusion of all peoples. We do have an annual Digital Day program, which again, I think the links are probably coming into the chat. That will allow you to post notes, comments, congrats to our promotion candidates. And please also celebrate with us at the DOM Annual Day 2021 Twitter hashtag. So the year in review. I can't start without acknowledging the bad that has been the context in which we've spent this year and more, with Captain Mladenovich in front of the now famous Sunnybrook tent. I think it's down now. Is it down? But it's been one heck of a year. And rather than me talking about one incredible heck of a year, I thought I'd just echo what I think we're all feeling through some pictures. And I will start, however, by reminding you that we did start the year with our priorities. We set 4 relatively new priorities that built on our first 5 years. First and foremost, to create a clinical and academic environment that promotes mutual respect, compassion, integrity, and inclusion, to innovate in our models of learning and care, to promote a sustainable person-centered healthcare system that meets future as well as current population needs, to continue our scholarship internationally and locally across all of the sciences and QI and patient safety, and to get political, which really we meant as getting engaged in transformational change as leaders. And despite the fact that we didn't plan for a pandemic, it's kind of interesting that this past several months, year and a bit, have actually accelerated all four of those strategies. So we'll start with the bad, because we can't avoid the fact that this was, as I said, one heck of a year and you guys are tired. These issues that are upon us with respect to racism, religious intolerance, nasty, uncivil behavior, our culture are not new. We talk about them now. But back in 2017, in our faculty survey, we asked about whether or not people felt their colleagues treated them with respect and civility, whether they were confident that they could address incivility without risk of retaliation, and whether they had experienced unprofessional behavior at work. This has been written up and now under review by Rena Patani, and she looked at the effect of race, gender, and their intersection on career satisfaction. I'm just showing you a couple of clips here, but what you see is underrepresented women in the yellow, what we've defined as overrepresented women in the darker orange, underrepresented men, overrepresented men. And I apologize that we only had male and female in terms of gender. What you can see is that there are clear differences based on our self-identities, where we see gender differences in feelings of being treated with respect, where men in general are more likely to feel that they're treated with respect. We see low confidence overall, inability to address incivility without the risk of a retaliation higher in men than in women. And we see a very significant dose effect in the experience of unprofessional behavior, where 56% of our underrepresented women reported having experienced unprofessional behavior in the prior year, relative to 25% of our overrepresented male group. In 2019, we implemented the Stanford Professional Fulfillment Scale, and we found that while the vast majority of people felt their work was meaningful at 85%, only 53% said that they felt happy at work. 46%, or almost half, were emotionally exhausted at work. Almost 29% felt that they had been less empathetic to their colleagues, and 32% met criteria for burnout. This is before the COVID pandemic. So while we are talking about all of these things antedated COVID, and COVID has simply amplified them. Last week, Karen Byrne's paper that looked at our 2019 survey results came out in PLOS One. The paper is entitled "The Impact of Organizational Culture on Professional Fulfillment and Burnout." And the bottom line is this, that higher professional fulfillment and less burnout are associated with later career stage, greater satisfaction with the efforts by the institution to create a collegial environment, greater agreement that colleagues are respectful and civil, and greater confidence in taking action to address unprofessional behavior. So I don't want to spend this time today talking about these issues, except to say that this department is fully committed to continuing our work towards culture change. And Rena Patani, who's been doing her rounds as our lead for learner mistreatment at the Faculty of Medicine, has given me, I think, a wonderful, she didn't give it to me, she's given it to all of us, a definition of allyship. An ally is someone who recognizes the unearned privilege they receive from society's patterns of injustice and takes responsibility for changing these patterns. We will be working very hard to advance our culture faster than we have in the past going forward. And you'll see in the last newsletter of the year a bit of a reading suggestion to start on this journey of real self-awareness and education to address the issues that have been raised. But we're not going to focus on that. We want to focus on the good and the great today. I just want you to recognize that I'm not brushing the rest under the rug. I actually don't know who these three gorgeous nurses are, but one of you probably does. I just love their vibe, positive and great. And I think that despite all the trials and tribulations of the past year, what makes this department so incredible are the people. So despite all of this, as I said a few minutes ago, we have been able to move our strategic priorities forward, in part maybe because the department was forward thinking in setting these priorities, which we did as a team, as a group, and because you've got such passionate commitment to making things better. I would say this is a department that most definitely knows how to turn lemons into lemonade. We've spent a lot of this year focused, for the reasons we just talked about, on culture and inclusion. Lisa Richardson came in March of last year, right at the beginning of the big pandemic roll up as our Vice Chair Culture and Inclusion. And over the past year, she's put together an amazing team that are working collectively to move our agenda forward. I want to acknowledge Simran Singh from Sunnybrook, Medonk, who's our faculty lead for wellness, Umber Najib, faculty lead for equity from GIM at Sunnybrook, Noreen Norris, faculty lead for Black and Indigenous resident pathways from geriatrics, Sunnybrook. I know there's a bit of a Sunnybrook line here. Catherine Yu, endocrinology at St. Mike's, our faculty lead for mentorship, and Eric Cohen, faculty lead for late career transition, cardiology at Sunnybrook. This is a dream team, and they are here for you, and they have already started their busy schedules and have set their priorities, and we'll be sharing more of that going forward. But, we talked a little bit about, how we can lead, and what we've seen is the transition of many of the members of our department into leadership roles in the faculty, which have enabled the work that we've been doing to go further. Rena, as I mentioned, has now become the director of the learner experience at the Faculty of Medicine and is doing an incredible job. And I think she's been to almost all of the hospitals to do medical grand rounds. And I hope the learners understand what a great resource this is. My understanding also is that her office is looking for a non-dom individual if people feel uncomfortable going to somebody, the learners going to somebody in our department. Lisa is sadly or happily, to bittersweet, has taken on the role of Associate Dean, Inclusion and Diversity. And I'll come back to that a bit later, but now has really got a much bigger role at the faculty level and has brought in Ayelet Cooper and Umbra Najib as senior advisors on both anti-Semitism and Islamophobia, respectively. And again, the preponderance of our department in these critical roles for culture and inclusion at the university is really, I think, a testament to the commitment of all of you and your passion for making things better. Trevor, the dean, Trevor Young, did mention in a chat at the All Chairs last week that we are building on and amplifying the courageous work of the department. And I want to particularly acknowledge both Arno Kumagai, our current Vice Chair Education, but also Sharon Strauss, our former and inaugural Vice Chair Mentorship, Equity, Diversity, for really having set the stage for the work that is now happening, not just across our department, but across the whole faculty. More than 1,000 people have listened to Sean Wharton as he presented his Department of Medicine medical grand rounds at our inaugural lecture in Black Health. I hope most of you, if not all of you, have listened to him, but he juxtaposed anti-Black racism with obesity bias. It was fascinating and just a really kind of amazing approach to helping us to understand both his clinical work as well as his work and lived experiences. So I encourage you, it's up there. We have, if you didn't know, we have a Department of Medicine YouTube site, and his rounds are up there. I watched Varuna Prakash at Women's Morning Report walk the walk with respect to EDI. She presented a clinical case and talked about erythema multiforme using multiple skin colors as a demonstration of how our dermatology division has been working to provide medical students and residents exposure to not the typical white person presentation for dermatologic presentations. We saw the Faculty of Medicine renamed to Temerty Medicine as a result of $250 million from the Temerty family. But the real reason they donated the money is because they loved the construct of increasing the diversity of our pipeline of physicians. We all know that the more diverse our healthcare providers are, the better the care they will provide. And in fact, this money has already been leveraging increased attention to pathways that will enable people who have not traditionally been well represented in medicine to join us in this path. Education's been extremely busy, and I'm not going to mention redeployment, although I just did. But we had a 5-year review. Arno Kumagai finished his first 5 years as Vice Chair Education, and I'll come back to that. But obviously, we went through a horrendous 2020 Royal College accreditation. We're about to implement the GIM redesign on July 1st, and there's been a lot of work underway to try to get over this hump of transition and figure out the unintended and intended consequences. We had to flip to virtual care and figure out how to teach in the virtual care environment. And a lot of attention needed to be paid to resident wellness. And I want to thank Tarek and Rebecca for having led that. Our CMRs have been amazing. They haven't had the usual CMR year, but I think I just like this picture. And here's Tarek with baby Malcolm demonstrating how to be well and balance life and work. So we had an external review of the education portfolio. It was conducted by Linda Probin. Linda is a medical imaging educator, but she's also the lead for accreditation at PGME. And she was really impressed by the Department of Medicine's education portfolio. We did 360s of our vice chairs in the process of this, and I just really want to read a quote. There were pages of quotes or comments, but this person wrote, "In the midst of preparations for the 2020 accreditation cycle, the COVID pandemic caused tremendous disruptions, both for learners and faculty members. He allocated great chunks of time meeting with residents directly and ensuring that they acknowledged and answered all their questions. He put a huge emphasis on wellness and ensured that all the departmental staff, faculty, and residents were prioritizing their mental health as well as their physical health. And obviously, we have reappointed Dr. Kumagai to a subsequent 5-year term. And just for a little levity, he has managed to grow a little ponytail. Didn't want to give us this picture, but I just thought it was just too good to not include. Sorry, Arno. We have 20 programs that went through accreditation. These are our program directors who have led their programs through this a massive amount of work. And Sarah Young, who's here, who is our administrative lead for education, who came in the midst of all of this. These people did a heroic amount of work, and I really want all of you to make sure that you say thank you to these people. They are much appreciated by the department, much appreciated by the learners, and thank you so much. As our newsletter last week laid out, of course, we have the announcement about the internal medicine program, and that we clearly know we need to address residents' concerns. And I'll again refer you to the newsletter. But Kevin Emery, thankfully, has agreed to be the faculty co-chair for the Internal Medicine Accreditation Task Force. The votes are coming in for the resident co-chair, and we will be announcing that later this afternoon. But let me just simply here acknowledge the incredible outreach from both faculty and learners to participate in making the change needed to fix the problems that we've already spoken about. Teaching in virtual care is not easy, and I certainly haven't indicated all the people that have been involved, but I do want to acknowledge the development of, in rapid fire time, primer for teaching and supervision in virtual care. I got to listen to Rebecca Stovall give medical grand rounds at Sunnybrook, and I just loved the concept of website manner. It's like, that's cool. And has also published a scoping review on curricular needs for training telemedicine with Howie and Rodrigo. So Heather McNeil, who's very involved with CPD, and the others have really been moving things along with Brian Wong as well. Just a nice picture of Brian. We saw amazing representation of our department in the Para Awards. And importantly, the Residency Program Excellence Award went to the Division of Geriatric Medicine for consistently providing an exceptionally positive and rewarding experience to residents, producing physicians who are expertly trained to deal with the challenges in their upcoming careers. I want to congratulate Dove, Helen, and Barb Lou for their incredible work, and for all the members of the division and the learners, and particularly for the nominees who enabled us to celebrate this outstanding division. We saw Sheldon Singh and Umbra Najib both receive Excellence in Clinical Teaching Awards. Again, we've got a bit of a Sunnybrook theme here. And Preeti Gross, who's now come into our clinician scientist training program, receive a resident teaching award. So congratulations to all of you. I tried to take a good look across the hospitals at teaching awards and ran out of room. The long and the short of it is we have amazing teachers. There's no color coding here. It's just to show you that we have incredible teachers, and I want to congratulate them on their accomplishments and being recognized as incredible teachers. We've had a few very senior faculty acknowledged for longstanding contributions. I want to congratulate Joanne Bargman, who just last week was awarded the Robert Narons Award from the American Society of Nephrology for substantial and meritorious contributions to education and teaching. And Rachel Shupak, awarded the Distinguished Rheumatologist Award from the Canadian Rheumatology Association for development and implementation of the ACBAC program, the Advanced Clinician or Practitioner in Arthritis Care, that has now trained more than 100 allied health providers to function in extended roles in arthritis care. Congratulations. Nice picture of Vanessa. Research was toppled over a little bit. Many of us had our research stopped, our staff redeployed, our labs closed. It was tough, but we also saw an incredible pivot to COVID-related research and major success, again, of our researchers in garnering funds to do this work. We celebrated, importantly, Insulin 100. We saw incredible innovations in virtual care. We saw the funding of the Novo Nordisk Network for Healthy Populations, and we conducted 5-year reviews of both the research and QI portfolios. So with respect to pivoting to COVID, many departments or groups would predominantly have been focused on vaccines for a variety of reasons. In fact, our major contribution, I really think, has been our incredible role in surveillance, epidemiology, scenario modeling, health economics, health services, and outcomes. And just as an example, this is a publication by Sharmista Mishra from St. Mike's on her modeling of surge in hospital and ICU admission because of the coronavirus. And it's work like this that has really prepared and driven the public health response to the pandemic. As typical research shut down, the department identified funds to create a COVID research grant competition. We received 40 applications, 5 were funded. We also had a complementary set of grants issued and funded by the University of Toronto. But congratulations to Ahmed, Laurent, Angela, Paul, and Jordan, who all received funding to carry out incredible work that's supposed to have pretty quick, swift results. 100 years since the discovery of insulin, pretty incredible moment, probably the best possible example of translational research still to date, from an idea in a lab, a discovery in a lab, to a patient, to a population, to the world. I really, really want to congratulate these 3 wonderful individuals, Gary Lewis, Dan Drucker, and Jackie James, for their leadership in 2 outrageously successful events in April to celebrate this discovery. The map is showing you in green over 75 countries that participated in these events. One was held on the 14th for patients, families, physicians, and really for people with diabetes, and then obviously the scientific summit. And again, thanks to the pandemic, we got to record these events. The talks are recorded and they're still available should you have the time to read and hear. And Jackie, you had the most incredible video, but I couldn't get videos to work really well, but she had her day in the public sun. Of course, Dan was also honored this year as a recipient of the Canadian Gairdner International Award for his research revolutionizing treatments for type 2 diabetes, obesity, and intestinal disorders. Aaron, his son, shown here in this picture, who's a scientist himself and dermatologist at Women's College, toasted his dad in our newsletter, and it's just such a great honor to have Dan and Aaron in our department. U of T announced the Novo Nordisk Network for Healthy Populations, which will unite experts in public health and chronic disease research to focus on uncovering new prevention tactics to halt the rise of type 2 diabetes. $20 million matched to $20 million of in-kind support from the University of Toronto. This is a collaboration between the University of Toronto Mississauga, Dalalana School of Public Health, and the Temerty Faculty of Medicine. The announcement was webcast to the world, and we got to see clinician scientist trainee Calvin Key talk about how important this donation will be to research to prevent type 2 diabetes. And I'm going to give you a sneak peek because it probably won't come out until tomorrow, but we have just appointed the inaugural director of the Novo Nordisk Network, and it is our Lorraine Lipscomb from the Division of Endocrinology, Department of Medicine at Women's College. And I really am excited about launching this work. There is more to come. There will be chairs and there will be funding for trainees. And this is a huge opportunity for our department. Congratulations, Lorraine. Virtual care went haywire, way more than other countries. We went from less than 2% using virtual care for clinical activities to 71% over the first year of COVID. And this is thanks to work by the Center for Digital Health Evaluation and Sasha Bhatia. And we saw the partnership between Geeta Mukherjee and Pel Agarwal, Women's with Brian Wong and CQUIPS, the group at Women's Virtual, and Gemini, and Moira, I think you're there along for the ride as a supporter of Fahad and Amol. But basically, they came together and they launched Long-Term Care Plus, which has really been a huge success, virtually providing support to primary care physicians, providing care in long-term care facilities. This is probably out of date right now, but when I last talked to Geeta and Brian, they had done more than 350 GIM consults and estimated that the avoidance rate for ED transfer was close to 50%. They surveyed long-term care physicians and the vast majority said the program was great and they would call it and use it again. We also saw the awarding of both Tier 1 and Tier 2 chairs, and we want to congratulate Gillian Booth, Herb Gazano, and Harindra Wijasundra, who doesn't look like that right now, for their achievements. These are a big deal. And Tier 2 Canada Research chairs to Daryl Tan and Charmista Misra again. So congratulations. 2 of our faculty were inducted as fellows of the Canadian Academy of Health Sciences, Daphne Gladman, one of my mentors, and Ravi Retnakaran from the Division of Endocrinology. And Ravi, I looked for that hair picture and I couldn't find it, but if I had been able to find it, then you know what I'm talking about. 2 individuals inducted as members of the Order of Canada. I am so proud to have been taught by Susan George, who was inducted for her pioneering contributions to the fields of molecular pharmacology and neuroendocrinology, and her colleague Heather Ross for her contributions to Canadian cardiac care as a clinician, translational researcher, and leader in the field of heart failure. Sarah Black received a Lifetime Achievement Award from the Society of Cognitive and Behavioral Neurology for her amazing research over decades in dementia, cognitive impairment. And she's also really been a mover and shaker up at Sunnybrook with the new, and now I'm blanking on the name of the new center. Okay, it'll come to me. Congratulations, Sandra. Mike had his 360 and review, just one of many quotes. Mike's an excellent motivator and knows how to get people excited about research. He's good at identifying that passion in others and nurturing it. But Mike and I agree that it's time to sort of take a good close look at our research portfolio. And we've asked Professor Imogen Coe, who's the founding dean of the Faculty of Science at Ryerson and a cell biologist by background and profession, to help us to build an inclusive excellence action plan for our research portfolio. So this will be beginning fairly soon, and our clinician scientists will be invited to speak with Imogen and help us to shape our way forward. Kaveh also had his 5-year review, and again, a couple of quotes. His greatest strengths are his intellect, breadth of knowledge and experience, networks, academic track record, thought leadership, inquisitiveness, and kindness. He has helped to put Canada on the map as a country where important research work is being done on quality and patient safety issues. And as of today, we have 66 clinicians in quality and innovation. 100% of them have been successful at continuing faculty appointment review and senior promotion. And that's a pretty darn good track record for this group of clinicians that only really just began. Our last priority was to get political. When we asked the individuals whose messages I previously showed why they do it if it can be so tough, this is what they said. So Susie Hota said, I truly believe that public communication makes a difference. Maybe it sounds idealistic, but if my messaging helps even one person make a better, more informed choice around one of the many confusing aspects of the pandemic, then I think it's worth it. And Seema Marwaha, who's the editor of Healthy Debate, said, not everyone has to do it regularly, but everyone should be able to, if called upon in the right circumstance, and understand the do's and don'ts to do it safely. It's both of professional and societal value to fill this need and falls under our public education and knowledge translation to her. I think we've seen an incredible demonstration of our faculty stepping up, speaking out. I really want to congratulate all of our faculty who have been major participants at the science table and other COVID tables. In particular, I want to congratulate Peter Juni for his leadership, scientific director leadership, along with Steny Brown. I know that this has been an incredibly trying year. And I think on that Thursday or Friday, when Peter told interviewers on television that this was, to be honest, one of the darkest days in his professional career and personally, I think that not only resonated with those of us in clinical medicine and at U of T in particular who know Peter, but really did influence the subsequent decisions that were made by our government. And I think is a demonstration of how the passion and commitment of our faculty and our colleagues can really make a difference. 8 of the 30 doctors in the medical posts power list for sway in COVID-19 are in our department, which is a pretty great track record. And I'm just going to show you the powerhouse. It's remarkably male, but that's okay. And just acknowledge that the contributions of all of these people have been amazing. We know that they're not the only people making contributions, but it's always nice to see recognition of a tremendous amount of work and talent. I particularly want to call out Andreas, who during all of this decided that he would move away from his editorial role at CMAJ and give other younger people a chance. And that demonstrated leadership is really exemplary. Susie was also called out for her leadership in preventing outbreaks in healthcare settings, and I think it's a great picture, and I think it's a great acknowledgement. We had 34 individuals eligible for CFAR, Continuing Faculty Appointment Review, which is co-led by Shifra and Mike. We had 10 deferrals, more than usual, 3 due to parental leave, so that would be typical, 3 due to illness not related to COVID, but 4 COVID related. So you'll remember that we did say if you felt you needed to wait, then wait. So 24 went through, 100% have been approved for continuing appointment. Congratulations. And we had a record number of promotions despite COVID. So Martin Schreiber, who now chairs the Senior Promotions Committee, did an incredible job with 45 candidates. You can see that the majority of them were going to associate professor. A smaller number, I believe it was 13, went to full professor. I've just put there the proportion that were women just for your information. And I just wanted to also point out that the proportion of women in our department who are either at the associate or full professor role, which means that they're eligible for chairs or leadership roles, has gone from 42% to 48% over the past 6 years. And the proportion of our department, full-time members of our department that are women, has gone from 36 to 41%. I really want to congratulate our associate and full professors. Here are half of the associate professors: Alan, Akshay, Lucas, Luke, Leahy, Hannah, Alberto, Aaron, Mark, Zeev, Raymond, Ebru, Yasmin, Raymond, Carolyn, Stephen. Congratulations, amazing. And don't forget, folks, you can sign and send them notes. Whoops, I missed a bunch. Here we go. Charmista, she's done a lot of stuff this year. Chris, Umbrin, Gillian, Jiwon, Alex, Sam, Lucy, Jeff, Mohammed, Hemant, Anne, Amar, Elizabeth, Liz, Renee, and Darren. Congratulations, everybody. And here are our full professors. Amazing accomplishment at the University of Toronto. Congratulations to Jordan, Jeanette, Dennis, Connie, Brian, Annie, Nadine, Candace, Samir, Kala, Ron, and Harindra. Incredible accomplishment, amazing portfolios. We are incredibly impressed. And yet again, I heard from the decanal committee that we have the most spectacular people. So well done. We also have a record number of Professor Emeriti. And we saw the incredible Charlie Chan on our screen, but I will just mention that these are folks who are moving to there he is, the highest echelon. Charlie Chan, Phil Connolly, Ivy Fettis, who I saw on the screen as well, Brian Gilbert, David Headley, Ed Keystone, Pat McEwen, Mark Minden, Norm Marcon, and Neil Shear. What a lineup. So these folks have contributed tremendously to the Department of Medicine, to the University of Toronto, to their communities, their divisions, and in many cases, to their hospitals. And congratulations, all of you. And if I could, well, I can clap, but congratulations. We've welcomed 95 new faculty, 36 of whom are full-time. And our young faculty leads, early faculty leads, Alana Weissman and Born August, are going to actually participate in new faculty orientation going forward, and are also going to put together a peer support group for faculty in their first 5 years. We welcome 10 new clinician scientist trainees whose names are here. And I don't want to freak you new guys out very much, but when I was looking for pictures, I pulled this out from Elliot Phillipson standing at a previous annual day. And if you take a look at the pictures, these folks are all pretty darn successful, either faculty or on their way to faculty. So it's a good program, and we are confident that you will be the next iteration. A number of transitions. I mentioned that Lisa has already moved on to her Associate Dean role, and we are extremely grateful for her time with us as Vice Chair Culture and Inclusion. Lisa is a force to be reckoned with and has taught me personally an awful lot. We will be posting the position of Vice Chair Culture and Inclusion later in the summer. We wanted to give you guys a little bit of time to regroup, charge your batteries, but we are looking for the new lead. Ed Cole has served us valiantly as PIC at UHN for a long time. Ed has been toasted to date several times, I think, and well deserves it, and has handed over as of, I can't remember whether it was March or April, I think April, to Catherine Tinkham, who's hit the ground running. So Ed, we are very grateful, and Catherine, we're already having a great time working with you. Peter Vadas has handed over to Steve Betchell as Division Head of Allergy and Clinical Immunology. And I really look forward to working with Stephen to build that division across all of the hospitals. Immunology is fundamental, and we are ill represented in terms of clinical immunology across the sites. Our program directors are probably exhausted from accreditation. Jeremy, after his first 5-year term, has decided to do other things. And he will be replaced by somebody, but I don't know who just yet, but rest assured, we will have an excellent next program director. Nazanin Meshkat, Emerge program director, will be handing over to Kaif Pardam. Nazanin has been a tremendous leader and advocate for frontline residents, her residents and her staff, and personally, I will miss her. Wayne has handed over to Nisha and Danny as Program Director of Infectious Diseases, and Wayne too, we will continue to work closely with in his role as Deputy PIC. But Nisha, we're delighted to have you, and it's going to be fun. And finally, Aaron Thompson has handed over, or is handing over, to Vince. Vince, this is an intense picture. The only choice I had is this picture, or one which was, I think, a rock band picture. I would have put the rock band picture, but as Program Director for Occupational Medicine, and we're pretty excited about what's going on there too. I really want to thank our staff. This is obviously an out-of-date Christmas picture, but you know, because of the pandemic, we don't have any pictures. And we have so many new faculty that have come in the past year or so that we don't have, you know, a really good composite of our faculty. Margaret Ma, our administrative lead for the department, has been sensational in guiding us over this difficult time with everybody working remotely. And I just, again, want to thank them for their hard work. I want to do a special thanks to Jocelyn Lagerquist, who's been with us covering mat leave, for our lead for communications. I have worked with Jocelyn before. She was our initial communications lead back at the beginning of my chair term. She played a fundamental role in the Insulin 100 celebration, and also in really revamping our communications program over the past year. And I will really miss Jocelyn. I think you will too. So despite everything, you've remained committed to providing the very highest of patient care. I know that you are passionate teachers and mentors, inquisitive and determined scholars. And really, I want to thank you for the incredibly hard work that you have done, and the fact that you're still here every day taking care of those patients, which at the end of the day is why we are all here. And we have to keep remembering that it's the patients that are driving what we do. This is from the WHO, but I thought I'd just leave you with this comment, which is, I think, very true. It's moments of joy and compassion that help us get through the hard times. I've seen this department pull together over and over and over. I see on evaluations and 360s and just hallway, well, Zoom hallway conversations, how supportive you are of one another and how supportive you are of the learners in our department. And I am extremely grateful for all that you do. I'll just remind you again to please make comments in the annual day digital program, or go on Twitter, tweet something, sign up for a memento, and enjoy the rest of the day. Most importantly, probably, I think we all need a holiday. You need to take some time this summer. I know everybody's busy and it's going to feel very, very difficult, but we have to recharge batteries to be ready for the fall. Thank you very much. And I will stop sharing. And then if anybody does want to make a comment, they can. Folks, how are you feeling? Oh my goodness, there's a whole bunch of things in the chat. Are there any things I have to pay attention to? Okay, folks, we've got 7 minutes. Let's talk. What are you thinking? Do you want to celebrate or congratulate anyone? Oh, you're very quiet. Lorraine, congratulations. Hemant, congratulations. Jerome, thank you for all that you're doing. Neil, congratulations. This is just, what an incredible, incredible team. Incredible, incredible team. Angela, tell us about your cohort. What are the long haulers looking like? What's ahead of us?
I'm one of 223 people at this virtual grand round. Really glad to see everyone. And just want to congratulate Gillian for a great overview of 2021.
Thank you,
I'll save Pankov for another grand round.
Okay, fair. Angela, you do have a big team though, right? On the long haulers. Yeah, yeah. All right, folks. I don't want to keep you if you don't have anything you want to say, but I'm always happy to hear from any of you. Please take time off. It's going to get tough. It's already tough. It'll stay tough. Hello, Adam. You look like you got a haircut. Maybe your wife did your haircut. I've got my husband who's good at circumcisions doing my haircut, so I figure he can cut my hair. So, all right, folks. Happy 2020-21 as we start the next academic year in a few weeks. Feel good about everything that you've done, all the great work that you're doing. You should be proud. You should be really proud about who you are and what you're doing and how beautifully you take care of patients. And we will continue to address our culture. Okay? Bye. See you later.
Thanks.